New plan to address the disproportionate impact of COVID-19 on the Black community. This includes spending millions of dollars on better supports and efforts to reduce vaccine hesitancy. Greg Ross has more details.
We realized that we needed a more targeted approach to reach Black communities.
A targeted approach to not only understanding why Black communities are being hit harder by COVID-19, but also to provide needed assistance to get the virus under control in those communities.
The city has invested $6.8 million in funding and partnered with 12 community agencies to provide this kind of targeted outreach and support to the top 10 neighborhoods with the highest percentage of Black Torontonians and the highest COVID-19 case rates.
According to statistics from the city, Black communities make up only 9% of Toronto's total population. Yet Black people make up 26% of the total number of cases right now in the city, and 24% of people hospitalized with COVID-19.
In public health, we've long known that it's your postal code, not your genetic code, that is the biggest driver of health. Access to housing, access to good jobs, access to health and social services.
I think it's a great start, and I think it's a necessary start.
Joseph Smith is the executive director of a nonprofit organization called Generation Chosen. He works directly with people in all of these communities, and he says there are many factors why COVID-19 cases there are high, including the fact many people work low-wage jobs that are considered essential.
If you don't show up, you don't get paid. And you need to get paid, especially during a pandemic, so that you can sustain yourself.
In addition to that, many live in small spaces with multiple people under the same roof.
And because they're all leaving the house and going to separate spaces, they're all interacting with a whole host of other individuals.
But the virus is just one of the issues. The other will be getting people to take the vaccine. Smith says there is hesitancy in the Black community because of a history of government testing on Black people.
That have now provided modern Black folk with the stories of the heartache and the trauma of those particular experiences.
To tackle that hesitancy, the city has formed a task force made up of scientists from the Black community who will work alongside Toronto Public Health to provide information, including 3 virtual public forums.
I want to encourage, and I want to repeat, I want to encourage all members of the Black community to participate in the 3 virtual sessions.
People will get an opportunity to raise any questions or concerns they may have about the vaccine. The first session is scheduled for February 13th. Greg Ross, CBC News, Toronto.
The province is set to roll out